Well, welcome back to Fox 51 today. Sleeping problems, so common. In fact, people in our office have them. My family members have them. They're just everywhere. But there are some ways that you can work to fix them. Dr. R.V. Guge with the Sleep Medicine Institute joins us this morning. Good morning.
Good morning, Rachel.
I was just telling you during the break, I have some sleeping problems myself. My family does. But first, tell us a little bit about the Sleep Institute that you guys have.
Well, Sleep Medicine Institute of Texas is a comprehensive sleep disorder center. So we do evaluation of patients, consultations, we do follow-ups and treatment of all sleep disorders. We have a sleep laboratory in there. We also dispense and provide patients with CPAP machines, masks, other things. We do actigraphy and insomnia management. So a lot of things, almost every sleep disorder, adult or pediatric.
So you guys pretty much have everything for sleeping. Well, now, my grandpa, I know he has sleep apnea. For those of us that don't really have anyone that has it or know about it, could you tell us a little bit about sleep apnea and how you guys are helping those people that have sleep apnea?
Certainly. Most people have obstruction during sleep in their air passage, and it occurs because the tongue relaxes and narrows the air passage. It can start very early, even in children as young as a year old, and it is usually associated with snoring. Most people wait for quite some time with their snoring before they seek help, especially after they start having problems with high blood pressure or diabetes or weight or fatigue or headaches or strokes or things like that. We do their clinical evaluation, we do their testing for sleep apnea, we confirm the severity of the sleep apnea, we find out if there are any associated sleep disorders, and then we treat the sleep apnea. There are many ways to treat sleep apnea nowadays. CPAP machines used to be the most effective, and they still are, but there are also mandibular appliances, oral appliances to treat sleep apnea. So we do all of that there at the Sleep Medicine Institute.
And I know another problem that you guys deal with a lot is a lot of people have insomnia. They can't go to sleep, they just toss and turn all night. Are there some treatments for insomnia?
Certainly. Rachel, there are many types of insomnias. And so the first thing to do is to find out what is the cause of insomnia. And there are some sleep disorders that cause the insomnia, and if you fix those sleep disorders, the insomnia disappears on its own. And then there is insomnia that has no other cause, and we treat those insomnias with anxiety management and helping them with organizing their sleep time, wake-up times, their exercise programs, and many other things.
And now I've got to ask you, now can any physician treat sleep problems, or do you need to come to a sleep clinic for this sort of problem to get help with it?
For the most of the time, Rachel, there was no training in sleep in medical schools. Recently, we started adding some lectures, and so most physicians, practically any physician, should be able to at least screen their patients for sleep disorders. But evaluation and management requires expertise and sleep testing and other forms of testing, so it's best done by a board-certified or a well-equipped and accomplished sleep center.
Well, that's wonderful. I have a question. If we want to find out more information about the Institute, where can we find that at?
Well, you can go to our website, sleeptyler.com, and there are some of our patients who have actually spoken on video shows and done some clips to show how their sleep disorders were treated at the Sleep Institute, and those videos are also on the website, sleeptyler.com.
Well, that's perfect. You can get your information and a testimonial. Well, thank you so much for stopping by, and that was some very useful information, and we'll see you next time.
Thank you for having me.
Well, coming up next here on Fox